Nicole Berberian is a specialist bariatric dietitian and nutritionist, joins us now, as you see. Nicole, thanks for coming in. We were chatting while that report was running. You were saying that the split in the UK between private providers of this kind of operation and the NHS is about 50-50. And actually, in terms of outcomes, it's pretty much equal across the board. The problem, in a sense, is that the consumer, the patient in all this, who often sees it as a cosmetic procedure when it's actually really serious, complicated abdominal surgery.
The first thing is surgery is currently the most effective treatment for weight loss and the most cost effective as well for this disease state, and it's a pathological disease state with consequences. Done correctly and done at the right time, the risks of not doing surgery are greater than the risk of doing the surgery. Done well, it's an incredible tool, giving results beyond what diet and lifestyle can do alone.
That's a great news story. What's the problem?
So the problem is that that's picking up in the report is that some of the centres aren't necessarily following through with the best practice, and some of the patients aren't getting the information they need. So it's knowing which is a good centre to go to. You need to go to a centre with an expert surgeon, with a specialist dietitian.
How do you know that?
Look on the forums is the best advice. Look up the forums, find out what are the patients saying, because patients are the best source of information. Those that have been through the treatment themselves. But the patients do need to know this isn't a quick fix if quick fix to you means easy. The patient needs to know in advance what are the risks, what are they going to need to do, what does it mean for their lifestyle, what sort of time input is it going to involve. Also, they need to have a lead-up time for all this information before the surgery, not rush through so they can weigh up this information.
It's not a panacea. The patient's got to make sure that once the gastric band is fitted, that they change their behaviour accordingly. Otherwise, they can be back to square one.
There's various types of surgery. Band is just one of them. First of all, you need to find the right surgery for the patient, and that needs to be assessed correctly. We need to have the support before the operation and afterwards. The support after absolutely needs to be regular care. They need to be regularly motivated, be sure that they're on track. The dietitian is key in this, where they see the dietitian possibly monthly, in the beginning much more frequently, and then after that it needs to be a long-term package of care, so they get yearly care afterwards for a long period of time.
And just help us with the gastric band bariatric surgery thing. I mean, quite clearly I was using it almost as a synonym, and it's not.
Yes, it's not.
I mean, gastric band, it's 50% of all bariatric
there's
surgery?
Gastric bands, there's gastric bypasses, which is the most long-standing surgery. With these different surgeries, it's important for the patient to know what sort of weight loss they expect. You don't necessarily see all the weight come off, you see maybe 50 to 70%. Different procedures for different people, and again, that needs to be properly weighed up and assessed. But really, a good centre will cover all of these before surgery. You should know before you have the operation. A surgeon, an expert surgeon, will have done many operations, not just 10 in a year, maybe 10 in a day. They do high turnover if they're a good surgeon, because they are the best, and you need to find those people. Find the best support package you can, ensure there's good aftercare, but make sure you know all this in advance.
Okay, Nicole.